Hello, everyone. Welcome to Brainwaves. I'm Brandon Staglin. As the mental health awareness movement gains steam, I hope that Generation Z may become the most involved generation yet. Mackenzie Drazan is a college student who, having lost a family member to suicide, has bravely chosen to leap into the mental health community by launching a website called teachingeveryoneaboutmentalhealth.com, or TEAM for short. Mackenzie joins us on Brainwaves today to talk about how she and her generation are advancing the mental health cause. And viewers, you may ask Mackenzie questions of your own at imhro.org/brain-waves. I'll post a link on the video after you watch the video. So Mackenzie, thank you so much for being with us on Brainwaves today.
Thank you so much for having me. It's an honor to be here.
Absolutely. Yeah, honor to have you. So kudos for your work. I've looked over your website. It's great. And can you please tell our viewers a bit about what TEAM is, what you aim to do with it, and why?
So the point of TEAM is to equip the friends and family of someone struggling with a mental health condition with the right resources and information necessary to actually take action and help someone who's struggling. Because it's really hard to know what it is to do if you don't have any experience in the mental health field. I think a lot of this has to do with the amount of stigma that's put on mental health. And so when you find yourself in a situation where you've never had it past of family members going through something like this, or maybe it's a friend or a boyfriend or a girlfriend or a son or daughter, you know, it's important to have the information and tools to know what it is your options are.
Okay, that's a great purpose. Have you tracked some good impact for your work with TEAM?
Yeah, so it's been an amazing and a great learning experience too. Just the sheer power of social media, which is something that's great for a more a lower funded kind of organization coming through, a newer organization, that you can really use social media and get a lot of outreach. We've had some posts that have reached 5,000 people and gotten 5,000 hits in one go, which is, it's been eye-opening, just the sheer possibilities that are available out there. And then also just opening the conversation to mental health, to stigma, to people really want to talk about mental health conditions. You know, I start telling people about my story and they come to me and will say, I lost a sibling to suicide, I lost a friend to suicide, or, you know, I'm really struggling with anxiety or depression, and everyone wants to talk about it, but they just need help to get there. And I really think that that's one of the amazing things about our generation, is that people want to talk about it. It's going to take an initial step of opening the door so that we can do that.
That's great. I'm pleased to hear that. So what are your future aspirations for your future involvement in the mental health cause, be it with TEAM or beyond?
So we have some really exciting new features coming up on TEAM. I'm working with a team to reprogram the whole site. When I built the site, I actually used templates to build it. So that's the good thing, is that there are resources out there for non-coders to really create resources that do work. But with the new site, it's going to have a feature where I call it a mental health Yelp and Yellow Pages, but it's going to be a way that we use geolocation software and a filtration system so that you can identify where you are currently through the system, and then filter through your insurance provider information, if you prefer male or female providers, and what conditions you're dealing with, to then figure out what therapists are available for you to use in the area, what treatment facilities are available, what treatments, and then you can read reviews on those treatments, on those therapists, to then figure out what is the best fit for you. Because there's a huge problem with finding the treatment fit, the therapeutic match can be a very lengthy, tiresome process. And actually, a doctor just described it to me once. It's like dating, where, you know, you're going to go and visit some people and they may not always mesh right away, but it might take a little while to find that one person you really click with. And I think that can be really problematic when you have people who are just coming to terms with maybe I should go get help. Maybe I should go see a professional. Let's try out treatment. And then they go to their first therapist and they're wondering, you know, is treatment for me? Is treatment not for me? And that's a big initial first step. But if you end up meeting with someone who maybe you don't mesh with, then that can deter a lot of people thinking, well, maybe treatment isn't for me. But we want to encourage people to get help. And I think this resource will really, really help to make that treatment fit happen a lot faster.
Very cool. Very cool. So I assume you've spoken with a lot of young people of your generation about what priorities should be for improving the mental health care system, and you just beautifully explained one good priority. What other ideas do you have about what the priority should be to improve mental health care, and how do you think we can affect those changes?
I think a really big thing that my generation really needs to focus on is education. People are scared of what they don't know, and I think that's a big factor of stigma. If you say, I have leukemia, that's a very scary thing, but people aren't afraid of you because you have leukemia per se, because there's a lot of treatment around it. So once, we can get to a place where people know that you can get treated for these conditions, and they can be scary, but people don't necessarily need to be scared of you just because you have a condition. And this all comes from, educating people when they're young. We go through physical education, starting in elementary school. We have sexual education, learn about healthy sexual practices. But, we know to brush our teeth even simpler, 2 times a day at minimum. And yet we're not taught how to have emotional education. How do you emotionally care for yourself? And that's a really, really vital part. It's kind of silly that we prioritize our teeth in education over our mind. So I think when we can teach people about emotions, what is the difference between sadness and depression? And when younger kids can start to understand these concepts, they're going to be a lot less scary. People are going to be more willing to talk about it. And we can identify kids at risk a lot sooner and get them treatment faster, which will have much more success rates in the future at making these conditions that people can live with.
Fantastic. So if viewers have any questions for you after I post this video online, are you ready to answer some questions?
Very ready to answer questions.
Okay, great. Thank you. Thank you so much. Viewers, if you have any, if you'd like to check out teachingeveryoneaboutmentalhealth.com, please do, and please ask Mackenzie some questions. Thanks, Mackenzie. I'll talk to you soon.
Thank you very much, Brendan.